Does varicocele surgery yield good results regarding delayed conception? The answer is definitely yes. Delayed conception, as we agreed, can be caused by varicocele. Actually, the surgery is simple and at the same time yields very good results. Peace be upon you. Varicocele is one of those very, very important things that concern many of us. And the truth is, we see it a lot in the clinic and I hear many questions about it. When do I know if I have a varicocele? So when, doctor, would I need surgery? I mean, as long as I have a varicocele, must I have surgery? Does varicocele affect the ability to conceive? Can varicocele cause pain? Can complications arise from it? Actually, these are many questions I get asked in the clinic. I wanted to make a video to clarify this topic of varicocele. Before we talk about symptoms and before we talk about treatment, we must first know what varicocele is. Varicocele is like any other varicose veins. It consists of veins. These veins take blood from the testicle and return it to the bloodstream again. But when the pressure inside them increases, the vein wall dilates. Like the varicose veins you see in the leg, these are veins whose walls have become weak, so they started to dilate and fill with blood. So what's the problem if this happens around the testicle? Actually, they found that one of the theories says that when varicocele occurs, these veins carry more blood than normal. And this increases the temperature around the testicle, which affects the quality of the semen. They found that varicocele affects fertility by impacting the quality of the semen. So what are the symptoms? Actually, varicocele has no symptoms unless it reaches a very advanced stage and inflammation begins, causing testicular pain. And visible veins start to appear like that around the testicle. If you feel visible veins around the testicle, or any pain in the testicle, or if a change in testicular size begins. Atrophy, meaning the size of the testicle starts to shrink, especially at a young age. Go to a urologist, let him examine you and perform an ultrasound. Okay, you've been married for more than a year, and there's a regular unprotected marital relationship, and there's a delay in conception. You must go to a urologist to examine you and confirm whether there's a varicocele or not. What do you do for the patient? First, we start with the examination. We start by examining the patient. We see what grade this varicocele is, and we see how the testicular size is, and we take a good history from the patient. We see if he has previously conceived or not. After that, we perform a Doppler ultrasound on both testicles. This Doppler measures blood flow, the amount of blood entering these veins, and whether there's reflux or not. We have 4 grades of varicocele. First, they call it subclinical varicocele. This is subclinical, meaning we can't see or feel it through examination. This is seen by ultrasound only. Second, grade 1 varicocele, which appears when you increase intra-abdominal pressure. When the patient coughs or strains, meaning the varicocele appears. Grade 2 is when I can feel it without the patient increasing intra-abdominal pressure. The third grade is when I can see it with my eyes. I don't need to examine. So when do we intervene or perform surgery? When we have a varicocele? First, at a young age. By young age, I mean puberty and the pre-puberty period. If we find that these varicocele started affecting the size of the testis or atrophy began to occur, then we must perform surgery to be able to preserve the remaining part of the testis. Secondly, when these varicocele are a cause of delayed conception, and in fact varicocele represent approximately 80% of the causes. Delayed conception and reasons for affecting the quality of the semen. The third thing is if these varicocele started to have complications. What are the complications that can happen? Actually, grade 3 varicocele, which are very large. The highest grade inflammation can occur in the wall of the vein. Thrombophlebitis, meaning inflammation occurs in the wall of the vein. And this is sometimes recurrent, annoying, and painful, causing pain. So then we remove the varicocele. Now, can varicocele cause pain without inflammation occurring in the vein wall? Yes, especially people who stand for long periods. You see it in teachers. You see it in people whose work requires them to be standing for long periods of time. So this makes the blood pressure increase inside these veins and causes very severe pain. Then we will also need to perform the surgery. So again, the indications. First thing, young age, and atrophy started to occur in the testis if it was affecting the ability to conceive. Recurrent inflammation started to occur in it, or it causes pain. Are there types of surgeries, or is it just one surgery? Actually, there are very, very many types of varicocele removal surgeries. It can be done via laparoscopy, and it can be done via surgery, and it can be done via interventional radiology by injecting a substance inside these veins to close them. And even surgery has several types. Anyway, without going into many details, the results of surgery are the best thing, and a specific type of surgery called subinguinal microscopic, or inguinal microscopic, that we open onto the spermatic cord in the inguinal canal area, and we use magnifiers so we can see the veins and be able to close them all or tie them all and cut them. And this in fact is what brings the best result. Now, does varicocele surgery bring good results regarding delayed conception? The answer is definitely yes. Delayed conception As we agreed, 80% of its causes are due to varicocele. And actually, the surgery is easy, and at the same time, it brings very good results. We do a semen analysis 3 months after the surgery. Why 3 months? Because sperm needs about 72 days to fully form. So, in order to see the new sperm that has formed after we did the surgery, we need to wait for 3 months before we can repeat the analysis again. These are the indications for the surgery. And as we agreed, subclinical ones that we cannot detect by examination, no surgical interventions are done for them. Now, are there any complications? We agreed on the complications that can happen. The complications, we said testicular atrophy, and we said delayed conception, and we said inflammation can occur in the veins. These are the complications that can happen from varicocele. Now, there are some questions people asked me also regarding varicocele, which is, does varicocele affect erection? In fact, it has no relation at all. Varicocele has no relation to erection. Does varicocele affect fertility? Yes, varicocele affects sperm quality and therefore affects fertility. So which surgery is better? None is better than the other. Some people say laparoscopy is better than surgery, but in reality, the results show that surgery has the same results as laparoscopy. There's no big difference, and the incision is almost the same, maybe even smaller, because in laparoscopy we need to make 3 incisions, one for the camera, one for the right hand, and one for the left hand. In surgery, we make a small 1 centimeter incision above the neck of the testis, above the scrotum, to be able to pull out the spermatic cord. It's just 1 incision, 1 centimeter. So all surgeries are good, there's no problem with them. But as we agreed, inguinal microscopic gives the best result. Another question I was asked, at a young age, should we treat varicocele if it's not affecting the testis? No, the varicocele must have started affecting the size of the testis to perform the surgery at a young age. Finally, I hope you benefited from the video. If you liked the video, please like, share, and subscribe to our channel to see the rest of the videos. Wishing you a speedy recovery. Peace be upon you.